Hello, everyone. Hello, my name's Susan Cole,
And I'm Matthew Hodson.
and welcome to aidsmapCHAT, our weekly show where we'll be chatting to guests from around the world about issues around HIV and COVID-19.
Yep, and we've got a fantastic lineup of guests for you this week. We have international activist and sex bomb, Bruce Richman. He's one of the founders of Prevention Access Campaign in New York. And if you've heard the expression "you equals you," it's probably something to do with him because he made it his mission in life to make sure that every person living with HIV knows that when they are on effective treatment and are virally suppressed to undetectable levels, they can't pass the virus on to their sexual
You
partners,
equals
which
you.
is you equals you. It's such a liberating, fantastic message, and it has been picked up around the world. But not only that, we also have one of the top HIV doctors in the UK, Dr. Rageshri Dhairyawan, and she will be talking to us today about some of the racial disparities that we have seen with COVID-19, and that's going to be a really interesting discussion. She
Mhm.
wrote a fantastic article about it, which I do urge people to look at. But wait till you hear her because she's also fantastic. And not only that, wait, there's more. We have Ian Green. He's the chief executive of Terrence Higgins Trust, the UK's largest HIV charity. He's also a really great friend of mine, lovely guy. But earlier this year, he got struck down by COVID and he had a rotten time on it. So it's going to be really interesting to hear his perspective on coronavirus too. So it's a great show today.
Wonderful. Are you not saying that Ian's a sex bomb as well, Matthew?
Well, I would say that, but it makes it kind of awkward between us if I kind of go into that kind of thing. So I try and avoid it. I think he knows. I think he knows
Okay.
really. But
Yeah.
yeah, no, but we'll avoid it. How are you feeling today, Susan?
I am fine. Today is quite a special day. It's my son James's 26th birthday, and it's the
26? No, you're kidding me. How old were you when you had him?
well, obviously about 5, but
Yeah, that makes sense, obviously.
yeah, I'm from Croydon, so not that, not that surprising. But it's very strange because it's the first birthday that I'm not actually with him because of the lockdown. So that's really peculiar and a little bit sad. But I would like to raise an issue that's very important to him because it's his birthday.
Right.
He works for the advocacy organisation Stop AIDS.
Hmm.
And one of the things that they're working on at the moment, as always, is equitable access to treatment for people. And earlier in the week, there was a global summit about COVID-19. And it's great that lots of money, I think 6.5 billion, has been pledged towards COVID-19. But what I think is really important is that we ensure that any money raised goes towards treatment for COVID and any potential vaccine, that it's available to everyone in the world, no matter where they live.
Yeah, I absolutely agree. I mean, I think that's one of the interesting things as we talk about vaccine development and the idea that this is going to be a real game changer in terms of lockdown and all of those issues. And then you look at what's happened with HIV, considering it has been uh, 20, 24 years now since we've had effective treatment almost.
Mhm.
And we still got a third of the world's population who are living with HIV have not got access to treatment. And so that makes you, and inevitably the people, the countries, the regions where treatment access is lower are those nations which are poorer, and it's that worrying thing is that health isn't health if it's only for the rich. um uh
Absolutely.
yeah.
Uh,
I you can
no, please, after you.
well, I mean, I guess the thing that I've been thinking about also this week is it's some of the kind of narrative around kind of looking at the number of COVID deaths, and then you can start comparing country to country, and that's been a very hot topic in the UK this week because tragically, the UK is now the country in Europe with the highest number of recorded COVID deaths.
Yeah.
And think is that right? We're the second highest in the world, just
I
behind
believe so,
the
just after
US.
the USA. Yes.
Yeah, but I would say that I mean, when I obviously I work for that excellent organisation NAM, and we produce aidsmap, and we look at the data a lot, and the difference in surveillance between countries is enormous. And with COVID, we're talking about a new condition, so there aren't the processes in place. Now, I don't know what the final figures will be, but the truth is we probably won't know how the countries really stack up against each other for weeks, maybe months. And even then, it may still not be accurate. I mean, in the UK, at least, we have mainly computer reporting, so it's much faster. In some countries, it's still on paper, and in some countries, they're just not going to record it at all. The thing which we're going to really need to watch out for is what's the increased death rate, because there are going to be a lot of deaths which are as a result of other factors, not COVID in itself. And I mean, I've been hearing from friends and colleagues in sub-Saharan Africa in particular, where there's not access to food, and they are reporting that their friends are starving because they're under lockdown. They're unable to put food on their plates, and this is going to be the huge death toll that we see as a result of COVID.
Yes.
It's quite sobering and quite difficult sometimes.
Absolutely.
So I'm going to cheer myself up by bringing a sex bomb onto the show. It's the only way. I hope he's there. Oh, it's Bruce.
Sex bomb. It takes a sex bomb to know a sex bomb.
Well, I only do it to embarrass you. How are you, Bruce? How are you doing?
Doing well considering, and actually really happy to be here and connected to you guys. This panel is amazing. Friends and leaders in the field, and not just leaders in the field, but also in the U equals U movement. So thanks for having me.
Oh, thank you for all that you have done. I mean, I know that you are also in touch with people, all around the world, because the U equals U message has become incredibly international. And I think one of the things that's really exciting about it is you see how different countries take it up and adapt it and make it their own. But one of the core elements of U equals U for me is it underlines the importance of treatment access, and that's something which is really challenging right now. What are you hearing on the ground about that?
Well, I mean, in the best of times, we know that treatment access, the social, structural, economic barriers make it difficult or impossible for people to get access to treatment. But now, obviously, it's made even worse. And our organization, Murray Penner, my colleague, has been working around the clock to try to help people in the United States get access to treatment and care. For instance, some folks are stuck in other states because they don't have the funds to get home, or there's travel restrictions. So he's been connecting them to services and programs, as well as people who are out of the country, or from out of the country in the United States and are stuck without it. But we're also hearing from our partners in LGBT Center in Wuhan, China, that they're still struggling. We supported them in the very beginning and getting treatment. Folks were riding in bicycles and trying to circumvent the travel restrictions to get people treatment. And the same thing, as you mentioned, in sub-Saharan Africa, we heard from Love to Love organization that people are struggling just to get basic needs, let alone treatment or diagnostics, and they're starving. They can't get the food support. So it's very concerning and troubling to us. But we are seeing a lot of movement, especially among young people in Uganda, to take the initiative and go out and help people get the support that they need.
We've just got Michael, who's the national ambassador for the young people living with HIV in Uganda, has just said that he's watching. So, hi, Michael.
Oh, fantastic! Hi, Michael.
And
William, I bet,
believe
is
in
watching.
Yeah.
Brilliant. Bruce, obviously in America, I mean, I was just saying that the UK is now second highest in terms of reported deaths as a result of COVID, but the US has still been the highest figure reported so far, and New York has been at the center of that. How do you think New Yorkers are feeling right now? And with the president talking about easing lockdown restrictions, I mean, do you think New Yorkers are ready to come out of lockdown, or?
I think people are really frustrated and it's tired, and there is lockdown fatigue, but it's not reasonable to think that we will be out of lockdown anytime soon. I mean, there's 75,000 reported deaths in the United States and 21,000 in New York City alone. So with the governor's proclamation that he's going to be opening up the state on May 15th, that's going to start upstate. And it's going to start with manufacturing and construction activities, but it's going to take a while for the city to start opening up. And as you're probably seeing there, we're seeing a lot of creativity and ingenuity and ways that people are still connecting to each other and feeling that bond. Online book clubs and dance parties and all sorts of meditations online and still being able to go to some parks and social distance. So we're getting through it, but not going to be open for a while.
And one last question for you, Bruce. What are you looking forward to the most when we're finally out of lockdown?
What am I looking forward to, for real?
For a family audience.
Hugs, a lot of hugging. I don't even remember almost what it feels like to be hugged or to hug someone. So a lot of hugging and that kind of, breaking the physical barrier when we can with as many people that I love that I can. And I want to hug you both as soon as possible.
I'm there for it.
Yeah, wonderful.
All right. Thank you so much, Bruce. It's so lovely to see you and talk to you. And we'll look forward to seeing you in person at some point when we can.
The better. Big hug and kiss.
Bye-bye.
Thanks for having me.
Oh, it's great. Yeah. Oh gosh, I do miss hugging. I went out the other day and I just bumped into some friends who were cycling, and we stood at kind of 3 meters apart and had a bit of a conversation. And then afterwards, after they'd gone, after they cycled off, I just wanted to burst into tears because I was just I normally would have hugged them and I couldn't. And it's just it's so hard. It's
absolutely. I'm really missing hugging, and I'm really missing McDonald's as well.
You're just trying to get some sponsorship or something, aren't you? You're just going to wake up tomorrow morning and they'll be like,
just bring me the free McDonald's.
Crates of Big Macs on your doorstep. Yeah, I love Maryland cookies, just in case.
Wonderful. Something that's really struck me a lot in the news today, more than anything, was the fact that Black people in the UK are, is it 4 times more likely?
4 times more likely to die as a result of COVID.
Right, yeah. And that's absolutely shocking and very worrying. But I think we know someone that can share some insights on that. So welcome, Rageshri.
Hi.
Thanks so much for joining us.
Thank you for inviting me. This is really exciting.
It's really brilliant to have you. I mean, I was really surprised. I mean, even though I had an idea about this data, but nevertheless, it was really shocking to see that death rate. So Black and brown people are disproportionately affected by COVID-19. But are we also seeing trends in other disease areas, and what do you put that down to?
So I think, I think COVID is just really highlighting kind of disparities in health that we're seeing in other disease areas already. So I think we already know that in other disease areas, there are lots of racial health disparities. And just with COVID, it's being highlighted for it really quickly and really obviously. So, for example, when we think about sexual health and HIV, there have been kind of racial disparities for a long time, which have not changed much. So, for example, we know that in the UK, people from Black and other minority ethnic groups are more likely to be diagnosed late with HIV. So that's an example of an HIV disparity that we know about.
Mm-hmm. Absolutely. And also in relation to women living with HIV, I mean, one thing that we're hearing a lot about at the moment is an increase in domestic violence. Are you finding that women living with HIV are at increased risk worldwide from gender-based violence?
Yeah, So I think in terms of kind of now looking at gender inequalities, we know that actually living with HIV means that people are more likely to be at risk of experiencing domestic abuse. For example, we know from global surveys of women that they may be 2 to 3 times more likely to experience domestic abuse, especially from a partner, than the general population. And we know that in itself, domestic abuse can be a risk factor for getting HIV. So I think we are seeing more, we're certainly hearing reports of more domestic abuse during COVID. I think the Metropolitan Police I think they're getting 100 calls a day about it. But it's really important to know that there are lots of services. So for example, there, in the UK, we've got charities like Refuge that have a 24-hour domestic helpline. If people are worried about being in immediate danger, they can call 999. And some of the websites have some good safety tips as well about being at home. And it's not only women, of course, that experience domestic abuse. We know that especially in trans communities, there are very high rates experienced, and amongst relationships, especially when men have sex with men, we see high rates as well.
Yeah. As well as people who are stuck with their families. I mean, often young LGBT people may not be actually accepted by their parents, but are now having to be in close proximity to them. And some of those people are not safe. I will just quickly big up the work of the Albert Kennedy Trust, who have been doing some phenomenal work in that area. Rageshri, I was wanting to ask you about HIV services, because I know that a lot of HIV doctors have been redeployed during this crisis. So how are HIV services coping?
So I think we're coping fairly well. We've had to make some changes really quickly, but I think we've had some good guidance from Beaver, for example. So what we really had to do is to make sure that we're making our services safe for patients and for staff, so reducing face-to-face appointments, making sure people have enough medications. And although we are being redeployed, so I was redeployed to a COVID ward last month, we still have lots of staff who are seeing patients. And I did a ward round of our HIV inpatients last week, and we're still seeing things coming in like opportunistic infections. So it's really important that if people feel unwell or they need medical advice or they're worried about their mental health, for example, that they contact their HIV clinic or come to hospital if they need to, because we still want to see you.
That's so important. Thank you so much, Rageshri. It's so lovely to talk to you.
That's brilliant, and hopefully we'll see you soon in the Real for a Real Hug.
Oh, that'd be
nice. Thank you so much. So, I mean, it's quite interesting talking about kind of provision of sexual health services in the UK. 5016 Street, Europe's largest HIV clinic, has been doing a big push on trying to get people to test, saying, well, everyone's having, or most people are having fewer sexual partners, or maybe some people are having the same number of sexual partners because they're just not having much sex anyway, or whatever. But a lot of people who previously were having a lot of sexual partners, a large proportion of those may not be having sexual partners anymore. And because of the window period with HIV testing, this could be a real opportunity to kind of get everyone tested, and so that we could come out of lockdown and everyone who has undiagnosed HIV could become diagnosed, could then go on to treatment. And Bruce would kill me if I didn't say, when you're on treatment, you don't pose the transmission risk to your sexual partners. You equals you, can't pass it on, in fact, which is relating to our next guest, because in the UK, we also used the expression "can't pass it on," and that was part of the really excellent THT campaign. And we have the big boss himself, Ian Green, CEO of Terrence Higgins Trust.
Nice to see you both. Thanks for having me.
Hi, Sex Bomb. How are you?
Yeah, I'm good. Thank you, Sex Bomb.
So, Ian, I mean, you actually had COVID yourself. You were the first person I know who got struck down by it. Also, you're open about living with HIV. I mean, how scary was that?
Yeah, I think to begin with, not so scary. I mean, both my husband and I became ill on the 14th of March. Started with a cough, then fevers, and I think the thing about this virus, in our experience, it lulls you into this false sense of you're getting better, and then suddenly it comes in a wave and hits you again, and suddenly you then start to feel really poorly again. So we were unwell for about 3 weeks in total. It got really scary when it affected our breathing, and that's when I started to panic a bit. And if you're struggling with breathing, panicking is the worst thing to do. But it was a real challenge for one weekend when there was some thought of me having to go into hospital. So I'm pleased that didn't need to happen. So it was scary. In terms of my HIV, I was less concerned because of the guidance that came out from the British HIV Association of somebody with a good immune system, with an undetectable viral load, should have no worse outcome than somebody who's not HIV positive.
Yeah, I'm really glad you said that, because I mean, this is something which I'm getting the whole time. People just like contacting me and saying, "Oh, I've got HIV," and then it isn't helped because the government or you know, emails and texts were sent to people saying, "Oh, you need to self-shield," when actually they didn't, and it was just a bit of the algorithm going wrong. So I think it's really important that we say that to people living with HIV, that unless there are other reasons why you need to self-shield, i.e. if you're over the age of 70 or even over the age of 60, you might want to consider it, but or if there are other underlying health conditions. But if you are living with HIV, on treatment, healthy, are virally suppressed, then there's no need to take additional precautions other than the precautions we should all be taking, which is reduced the amount of time you're going out, wash your hands, don't touch your face. He says wanted to touch his face terribly.
Yeah. I think you're right, Matthew. I think it's about making sure that, you know, that our view as an organisation is, you know, follow the guidance that coming out from Public Health England and from the government, and you know, it's really clear, and from the British HIV Association, it's really clear that, as you say, that somebody with a good immune system is HIV positive. There's no additional risk.
Absolutely, and to bear in mind that many of our viewers are from all around the world,
Exactly.
so people just need to follow the guidance for their local area. Absolutely,
really important, Susan. Yeah.
Unless you're in Brazil, in which case don't ignore the president.
Yeah.
Sorry, scheme. Thought I'd say that. So, I mean, obviously, I think that one of the things which we're also talking about and thinking about quite a lot is the other costs of COVID, and you know what. All sectors are being affected, and you know, we don't know when restaurants will reopen, or if. We don't know when theatres will reopen, or if. We don't know when football stadiums will reopen, or if. And you know, we know that the world into which we emerge is going to be quite different. And one of the other real concerns, and I guess this must be a concern for you as the chief executive of a charity, is what's happening to the charitable sector. I mean, I see a lot of charities are really struggling right now because their income sources are being cut off entirely, or are being diverted, because funders are now wanting to go into COVID, and we may see a cost. How are you dealing with that as chief executive at THT?
Yes, it's a real challenge for many charities and for THT. I mean, it's estimated that the charitable sector overall in the UK over the next 3 months is going to be about a £4.2 billion impact, a loss of what they would normally get through fundraising activities. THT has 2 sources of funding, from statutory services, which currently are unaffected, and then from our fundraising activities. And we raise about £6 million a year from fundraising activities, and we think that's going to be impacted probably by about 40%. So that means we're going to have to do less, and we really think for us it's important that we protect our staff as best we can during this difficult period, but it's going to have a real impact. Government have announced some funding, about just £750 million, but that's going to go nowhere near to meet the shortfall in many charities' financial situations over the next 12 months or so.
Yeah, and I mean, you know, there's so much that is tragic about the whole situation we're in. But I mean, for my own part, there was a project which NAM was going to be doing. We had a funder who had agreed to fund it, working with trans people's HIV prevention needs, and it was a great project. And then we just got an email this morning saying the funder said, actually we're diverting all of our funding into COVID, and obviously that's really important too. But you just kind of go, I was so wanting to do work with this community, and people have got so excited, and we were talking to trans activists, and they were so excited about the project, and now it's just gone.
And there's a whole thing about focusing on the current challenges, but also I want the charitable sector to be resilient and strong in the next 12, 18, 24 months to respond to the fallout from COVID. It's so important that we've got a really strong civil society that can respond and can challenge and can make sure the voice of people aren't lost within that response.
Absolutely. And what's your message for THT regarding sexual health at the moment through this crisis?
So guys, that THT is probably one of the most sex positive organisations. It's been in our DNA in the almost 40 years that Terrence Higgins Trust has been in existence. We've been exceptionally sex positive. And it really is a real challenge for us to be saying at the moment, no hookups. And actually, it's really important in the current environment just to think about if you're going to have sex with somebody within your own household. So your sexual partner, if you live with somebody, or to think about other ways of having sexual pleasure during lockdown. And so that's been a real shift in emphasis for us as an organisation, and for us to say it was a real challenge to get that across, but it's so important.
Yeah. I mean, I'm trying to remain as sex positive as possible, but I just do it by the medium of selfies.
Yeah. You do that very well.
People are sending you lots of messages, Ian. We have Fidelma Neo. She says that she went through a very similar breathing trouble as you had, and she said it was really good to hear you share your experience. And someone called Mark Edgley is just saying,
Hi,
fantastic
Mark.
to see you looking so well. And I will vouch. I mean, I was in a meeting with Ian when he was like just kind of on the cusp of coming out of the worst of it. You look like hell.
Yeah.
You look so much better now. You look glorious.
I'm sexy.
Sexy as hell.
Wonderful.
Ian, it's fantastic to talk to you as always. Take care of yourself.
Wonderful. Hopefully see you soon for a hug.
Bye.
Bye-bye.
Oh,
that's so wonderful. What brilliant guest.
Was it there? Yeah, no, it was.
Yeah.
Right. Well, thank you to our guests. Thank you, Ian. You look wonderful. It's great to have you. Bruce, always a pleasure. Rageshri, amazing to have you on the show. So thank you all so much.
Yes, and I'd also like to thank everyone who's been watching on Facebook and Twitter. I know other people are going to have the opportunity to watch it. It's going to be online afterwards, and I would like to thank Disruptive Live for doing their technical wizardry in making all of this happen. Matthew, you haven't disappeared so far in your... We're still hearing you.
Despite your best efforts, Susan, I'm
keep
still
trying
here.
To like press the mute button, but you're still talking.
That's why I don't give you that power, you see. Because I know that you would not use your power for good.
So who do we have on next week, Matthew?
Next week we have my colleague Kevin Fenton. He is now the London lead for Public Health England. So he's literally just gone into that role. Imagine starting that job at this time. I mean,
yeah.
He has said he will be on the show. If he is looking a bit stressed when he turns up, I think we all have to forgive him. We also have, I'm going to refer to her as the beautiful story that is Doreen Mora-Maracha. She is a HIV stigma warrior, battling stigma in Kenya. And we have a member of parliament. We have Lloyd Russell Moil. He was the first UK MP to disclose his HIV status in a parliamentary speech, which he did. Was it last World AIDS Day? Was it?
Yeah, the one before that. It was momentous.
He is a fantastic speaker. If you're not someone who's hooked to the Parliament channel like I am, and you haven't seen him speak, he is just brilliant, so smart, so sharp. kind of cute as well.
So yeah, we're very excited to have everyone on. What a brilliant guest we're having, and it's 6 p.m. next week on NAM's Facebook and Twitter. So do please join us then. And I think we've now run out of time.
Oh, such a shame. It's been lovely. All right. Thank you so much.
See you next week.
See you next week. Take care. Bye.
Bye.